Morning. I'd like to call the executive committee for Tuesday, January 26th to order. If we could get a roll call, please.
Mr. Lear?
Present.
Mr. Hess?
Present.
Ms. Polk? Ms. Weber?
Present.
Mr. Payton?
Present.
Ms. Parker?
Present.
Mr. Kinzinger? Mr. Fairfield?
Present.
Mr. Carrico?
Present.
Mr. Featherling?
Present.
Mr. Miller?
Present.
Mr. Long?
Present.
Mr. Hunter? Mr. Wheeler?
Present.
Mr. Searoy?
Present.
We have a quorum.
I'll just, no need to.
All righty. I have no public comment requests. Approval of the minutes from December 21st, 2020.
I'll just.
Is there a motion?
Closed.
Mr. Kinzinger, second. Mr. Hunter. Hold on just one second here. Do we have reports from schools, veterans, VAC,
No.
administrator report? Let me do that. I tell you what, can I have a motion to combine and approve the minutes and the county administrator's report?
We'll withdraw our motion.
Is that okay? All right, we'll just change the motions to include that. So then we just have to vote on the appointments after that. Okay, roll call vote, please.
Mr. Lear?
Aye.
Mr. Hess?
Aye.
Ms. Weber?
Aye.
Mr. Payton?
Aye.
Ms. Parker?
Aye.
Mr. Kinzinger?
Aye.
Mr. Fairfield?
Aye.
Yeah, it wasn't too bad.
Mr. Carrico?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Long?
Aye.
Mr. Hunter? Mr. Wheeler?
Aye,
Mr. Searoy?
Aye.
Motion carries.
thank you. Before we get into legislative, I just had a couple of things. The first of all, I wanted to apologize to the committee and to the City Council of Kankakee. I completely, when I put out the agenda last week, we forgot the land bank off the agenda. And so we're gonna have to tackle that in our next meeting. We have to vote on it in committee and then the full board, and we won't have an opportunity. So over the weekend when I noticed it was gone, it was too late to put it back on an agenda. So yes, Mr. Hunter.
You know, for the record, you know, I've had some strong concerns with respect to those board members, participants, et cetera, in as much as we're making decisions regarding Kankakee County and those entities therein. I would humbly request that all members, uppercase, be residents of the county.
Okay. I'll, if you don't mind, can I make a note of that and we'll bring it up as a discussion point when we start talking about it?
That's
Because
correct.
then the committee could amend if they so choose and send that to the full board.
Okay.
That's probably procedurally the best way to go about it.
That's
So,
correct.
yeah, I hear you. And then the other thing I wanted to at least announce, I just got this last night. It's more for finance, but I thought the executive committee, because typically we're the policy committee, HR comes out of here. I try to let people know when I see trouble coming, but also when good things have happened. So in this case, good things have happened yet again. Our county has qualified and been awarded the GFOA Certificate of Achievement in Excellent in Financial Reporting. Once again, it's been, I want to say 4 years in a row, something like that. It is, I'll read what it's. The Certificate of Achievement is the highest form of recognition in government accounting and financial reporting, and its attainment represents a significant accomplishment by a government and management. It's basically a transparency award on all of our financial information. And it's done as a result of the preparation of our, it's called the CAFR, that is attached to our outside audit every year. So it speaks to the soundness of our internal controls, our policies, our procedures, the things we do within the financial reporting structure of the county. So once again, and that effort is from Steve McCarty, led by him and his team. You know, it's tough to get these types of awards when things are as bad as they were financially in the county. And they still, even though it wasn't good news, but they presented it and gathered the information in an exemplary fashion. So I just want to let the board know that you got some, from our county administrator on down, we got some good people working for administration here. And so my congratulations to Steve and his entire team. It's excellent news.
Mr. Chairman, do you
Yes.
put that on our Facebook page?
We will get it out there. Yeah, I got this last night about, 9 o'clock at night. So
You
yeah.
do a press release on it?
Yep, I've just sent it over to the paper
Thank
this
you.
morning. Yeah, so yeah, we want to get it out there, and we'll have more to come on this. They usually give a higher quality plaque than we give at this county because they got more money than we do right now. So GFOA. So basically, it's a financial reporting award on the numbers. All right, moving on. Under legislative, did you have anything today, Mr. Lear, under legislative?
I don't have anything.
Thank you. The next month, it is my goal, and I'm going to hold myself to it, is providing a list of all of the bills that have relevance to the county, and board members can take a look at those and bring other things up. We'll come back to this committee and have a prioritized discussion, of where do these rank? Where are the things that we need to do? What type of guidance do we want to give our state senator and representative in the House and our lobbyist about what are our priorities? And usually it's about the top 5. And then there's other things that you can kind of focus in on. So between now and then, if you have your sources of information, I'll be distributing a list that I see as things that we're talking about. Obviously the pipeline in Hopkins Park is a major thing, which includes broadband for out there. But there's a lot of bills that are going through right now that have significance to the county. We hear a lot about the defunding bill that's going through. And I've talked to a lot of law enforcement people. There are some really good parts to that. There are some parts that aren't so good as far as law enforcement goes, my own personal opinion. But you don't throw the whole thing out because you disagree with part of it. You maybe lobby for what you agree with. So we as a board can make those decisions, vote on it here, then vote it on the full board, and then we have a legislative agenda that's been blessed by a majority of the county board. I hope that makes sense. We haven't done that since I've been on the board, and I think it's a good idea, at least that if we're focusing efforts, that we push forward in a logical manner and together. Mr. Hunter.
Thank you, and I don't want to monopolize this morning, but a lot of information. You're correct. You guys may recall the resolution that we adopted with a non-dissenting vote regarding support for funding police, the sheriff's department. It was all encompassing, and it also dealt with a multiplicity of things in terms of civil rights and so forth. And I thought it was, I think we were ahead of the game in terms of some counties and some municipalities in terms of the steps we took. Additionally, the chairman and I have both talked to Representative Haas and Senator Joyce about coming to this body and I guess receiving feedback, input, recommendations as to what we deem important as far as municipal or county government. Oftentimes bills are passed down in Springfield, without any financial assistance to implement those particular laws. So hopefully at some point that they'll coordinate their schedules and mesh it with ours, and we'll have an audience here at the county board meeting, and we'll have an opportunity to convey concerns and questions and messages that we want them to address when they're down in Springfield in both houses.
Yep, thank you. It's it seems logical to get what we want together, prioritize, and send it on. And to your point, Mr. Hunter, there was a bill introduced. I don't know what party introduced it. Doesn't really matter. It was a bill that would make it impossible to have any unfunded mandates.
Yeah.
I see that failing. It won't even make it out of committee if I know Springfield well enough. But hey, we have hope, right? Because that's the problem. We don't disagree with a lot of things, but when it becomes unfunded, they just keep pushing more and more down to the county level, and they don't realize that of all the people, we have the least amount of money. So why keep pushing more in our direction? And that sooner or later that it's going to come to a breaking point where real services and things that we do is really mandated suffer because of it. So,
Your Honor, and you touched it regarding the police reform, House Bill 163. I don't know if all you guys have talked with the sheriff about that. He had very strong feelings about that, and I know the senator talked with a lot of us regarding that bill. Some of that stuff should have been separated. Some of the, the cash bail thing, I've talked to Jim Rowe about that, and of course that impacts us. And some of this stuff won't take effect until 2023. However, hopefully there's time for amendments because, as you just mentioned, Mr. Chairman, that, some of these things are required and there's no financial assistance towards implementing the letter of the legislation. So, yeah, you're correct. You're right on target.
thank you. Does anybody have anything else legislatively that, for the group here, or we'll look forward to next month to having a robust discussion? Okay. All right, seeing none. Information services, Kevin Duvall.
Okay, you can hear me, right?
Yes.
Okay, I'll keep it brief here, just letting you know that inside the county, seems like things are getting back to normal pretty much. As I believe that most departments have their staff completely back in. We're starting getting the normal calls that we would have, things like, somebody's deleted important files or email issues. So our normal calls throughout the day are starting to get back to the regular level. So what we're working on currently, we have for the highway department, we placed an order for a server so they could update their server back before Christmas. That's coming. We'll be working on that for the next several weeks because they're going to switch over their server and do some upgrades to their network to make sure it's on the 2021 level. So that's a sizable project we'll be working on. In addition, for the county clerk, they made a purchase of a server mid-year of 2020, but Dan had us wait until after both elections. Now that those are gone, we'll be addressing that so we can upgrade their servers to 2021 levels. We already separated them off so they can meet some state guidelines of being isolated from for the rest of the departments, and that went well. But we'll be working over that in the next several months. We need to make sure that we allow them to operate on a daily basis. So that makes the process go a little bit longer, but we've done it before. As far as the planning and admin department, I believe the chairman has discussed that there's redistricting software and a server that was talked about. We received that yesterday. That came in. I had put Jason on it. We're going to be working on that together with the planning department. They'll make the purchase, we'll put that on, and then there's some internal things that the chairman has talked to my department about doing. That's our high priority right now. We're working on that. And then in general for our department, this was a year that now that over the last 2 years, we completely upgraded all the desktops in all the departments that we're dealing with. Now that we have that, we're addressing some of the other issues. We've significantly upgraded a significant number of servers we have for the courthouse. As I've discussed before, we're hoping that we can finish that part of it. Once that's done, we'll reassess our whole backup program. We know it works now and it's very efficient, but we're always looking for improvements on there. So that's a long-term project that we'll be working on. All of these things should be already budgeted for, so I'm not here to ask for any money. I'm just informing the committee of the projects that the IT department is currently working on. And if you have any questions, I'm here.
Does anyone have anything for Kevin? All right, hearing none. Thanks so much, Kevin.
No problem.
Moving on to Health Department, John Beavis.
Good morning. I'm going to go over made some notes, and my intent is to eventually get this emailed to both our Board of Health and to county board members in regards to sort of currently what the health department's plans are in regards to the vaccination rollout now that the vaccine is available in the community. So I just wanted to go through a few things here. Vaccine doses are still in a limited supply. Obviously, you know, they were only approved just at the end of 2020. We have to order that vaccine week to week based upon an allotment that the state tells us. Some of that depends on what we ordered the previous week and have, you know, doled it out to either the hospitals or some of the pharmacies that are performing this work with us. As a result, if an agency stockpiles it, for example, and doesn't use any into the next week, then that counts against us for the next week's allotment that we can order. So the state's plan is what we order, we're supposed to try to use within that next week. So that impacts, 2 weeks ago, for example, we were able to get 2,300 doses to then farm out. Last week it was 1,900. We won't find out until tomorrow what this week's order will be able to be for going into next week. Obviously, to be a provider, any location has to register with the, it's called ICARES, I-C-A-R-E-S is the acronym. That stands for Illinois Comprehensive Automated Immunization Registry Exchange. And then there's a whole litany of things that an agency would have to comply with in terms of record keeping in regards to ordering the vaccine, getting the vaccine, storing it, using it, and then record keeping. So this isn't as simple as just getting the vaccine and having people who can give the shots. We have a number of facilities within the county who are becoming registered. Many of the doctor's offices can do this. They're already registered, for example, as, you know, flu shot givers and the other vaccines that they give within their practices. So the goal is, hopefully, as we go a few months out, we have more physicians' offices, pharmacists, within the grocery stores, the hospitals, and the health department that are going to be providing this vaccine at various locations and in various methods for everyone to get these shots out for the individuals as we're in the particular phases that we are. I can tell you, and I know the frustration for the public, you know, of having to order week by week and having some of this information change almost daily per the state is frustrating. I feel that pain too, and, you know, we're doing the best that we can with the staff that we have to try to do that. So we are continuing under the water, so to speak, to plan, schedule, vaccinate the various groups within the phases that we are in, and we are currently in the phase 1B, started that on Monday officially. So that is going. We have a clinic actually going on at the health department today. We're vaccinating over 260 people. It's a second dose vaccination clinic, so it's, you know, 4 weeks ago we gave these individuals their first shot, so they're wrapping up their second shots today. Throughout the next 2 weeks, we're going to be vaccinating all the schools. We've already scheduled most of those clinics, and we're going to be going off-site to those locations. The schools have been doing a great job being ready for us, you know, setting up areas where, you know, within the gymnasiums, for example, where they have enough seating to have the individuals that have to sit for the 15 to 30 minutes after their vaccination. We're sending the nurses. We haven't needed to get any additional help yet for that. We anticipate having the schools done by the first week in February. In the meantime, we are also working with Jewel and Meyer. They are already on board, and we are sending them names of individuals that have registered for the survey, and if they meet the qualifications to get the shot, then they're contacting those individuals, you know, behind the scenes from what we're doing. So there are other agencies out there performing these shots also to slowly and methodically, you know, get through this list. This 1B phase is going to take a couple of months probably, as best we can tell, and as things start to wind down, then obviously the state will move us into 1C, or depending on how much vaccine is available and the weather, you know, then we may be able to approach those situations where we can then conduct a massive outdoor clinic, drive-up type thing, where we have, you know, health department staff working with, you know, ONU, KCC, and the hospitals in regards to additional staff to pull off something like that. We have that plan in place. It's just, you know, obviously today would be a very bad day to do some sort of an outdoor clinic, which is the problem of trying to do one in the winter. To help accommodate those that are interested in receiving the vaccination soon, the health department has a survey up on its Facebook, on its website, which is kankakeehealth.org. We have publicized this. People can go in, you just basically click on the link, you give your name, your age, your occupation, and then we will contact you when it's time for you to get your shot. You don't have to keep calling us. You don't have to say, am I on the list? Am I still on the list? You haven't called me yet. You're on the list if you've registered, and eventually we'll get to you. You will be contacted at that point and told where to go and who's going to give you your shot, and then you have to just to be able to make sure that you can schedule your second shot. The next question we typically get is, well, I'm an older individual, or I don't have internet, I don't have a phone. Okay, well, we created a phone number that just went live last week. That number is 815-802-9449. Individuals can call and leave that information. You basically just leave your name. I'm John Beavis. I'm 58. I work at the health department. I'm interested in getting the shot. And we have recently added some new questions where individuals can list things like their underlying medical conditions that helps to possibly, you know, move them up in the list when we get there in regards to somebody else, because we obviously want to get everybody who wants a shot to get one, but we want to try to get the most vulnerable individuals first.
Could you repeat that number?
That phone number is 815-802-9449, and that's our COVID registration survey phone number. So that goes directly there, and that's the information you give us. And then obviously we have other phone numbers for the contact tracing and any other questions or services. You know, those get routed somewhere else. This line is specifically for individuals, and you can call on behalf of an individual. You can register for, you know, if you have an older mother or father or somebody like that that's not going to be able to call, you can register for them, and then leave your information so that we can contact you and make arrangements to get that individual that shot when it's time. We continue to host the free Illinois Department of Public Health COVID testing in our parking lot. We have one today. I think we have one scheduled for Friday. Obviously, the need has been dropping. We were doing hundreds in a day before. You know, now we're doing 50 and less. That's good. That means we have less, I think, in the community. COVID positives, that is, and I think that bears out because obviously our region is doing much better now. We've come out of the mitigation, but it's still present, and there are still individuals that need the testing. There's a number of sites available, but this provides an opportunity for individuals. You don't have to have insurance, you don't have to pay, and it's easy there on the end of town. So we're going to continue to do that as long as the state is providing that service. We just ask people to go again to our website or our Facebook, or call us if you're looking for the dates of when those events are. We still have those rapid test kits. We're making those available to the agencies that, again, have registered and are able to comply with all the guidelines there. That's been very good and is helping to find a lot of cases early on, and we can get those individuals quarantined and sent home without them having worked for another 5 or 6 days before they find their results and then have contaminated maybe an entire department or division. And then obviously we're continuing to do the contact tracing still throughout the county. We ask anyone, if you have questions or concerns, to visit our kankakeehealth.org, our website, for questions. You can go to Illinois Department of Public Health and get information there about COVID and the statistics. And then lastly, I just would like to say, and this was based on some conversation from last month, the health department has been in contact with and is scheduled to participate in a town hall informational virtual presentation. It's scheduled for February 16th, 2021 from 6 to 7, I believe. The county health department, along with AMITA, St. Mary, and Riverside Hospital, hosted by the NAACP, will be hoping to better educate the public on the benefits of the vaccine versus the risks of COVID-19. So I'm really looking forward to that. Appreciate the invitation to be able to participate in that. So with that, I open it up to any questions.
I had
Chairman?
one real quick one, if I could, sir.
Yes.
The extra doses. Last month you were talking about how there was extra doses in the vials, and then we had to send them out of the county, obviously, because that was part of the state's requirement. And I did see something on the news that said Pfizer was going to reduce the amount of doses they were sending to the U.S. because they admitted that countrywide there was extra doses in all the vials. Did you hear anything about that?
We are aware that both Pfizer and Moderna had, for the most part, when we opened up a vial, what we were originally told, I think one is 5 and one is 10, that there would be 6 or 7 and sometimes 11 and 12, and maybe even 13 doses we were able to pull out of those vials. So those became extra. To correct something, I think a month ago, we had extra doses that we were able to send to a county that was in need, that we didn't have need for those vials at that time.
Correct.
Otherwise, we've not been sending anything out to anybody else.
I agree. That was just the one time.
That was just the one time.
Because we couldn't use them ourselves because under the governor's orders, it was only going to certain people, and we had already got that to that group of people.
Correct.
Okay.
In a webinar yesterday with the state, my understanding is that at least Moderna, possibly Pfizer too, are now reevaluating the amount of vaccine that is available per vial, and based upon the original allotment and number that was determined to be coming. So if you had 100 vials, equaled 1,000 doses, for example, now it's going to be 100 vials equals 1,100 doses, and that is what we would be ordering. So they're attempting to account for the extra vaccine availability that are in some of these because of the material that's in it.
It had something to do with the way the contract was written, that the United States agreed to pay per dose and not per vial.
Okay.
You see how that, and
I
so
see.
there's catch up to do, and if they've already allocated those doses worldwide, they needed to account for it somehow. So I didn't know if there's been an update on that. That was relatively new 2 days ago. So
Not so
and
much.
it wasn't one of those acronym
Okay.
news channels. So it was real news. Mr. Hunter.
Yeah. John, thank you so much for mentioning the virtual COVID-19 town hall meeting scheduled for the 16th. And I know we had discussed that, and I know Lori Gadboys and I and a bunch of other folks are involved with the planning of that particular initiative. Additionally, it's kind of patterned after CNN. They had one about a month ago, The Color of COVID, with Fauci, Gupta, the director of, I think, the Morehouse Medical School, and some other prominent individuals throughout the country. Additionally, there's some reticence about people who look like me participating in the vaccine program by virtue of past history in terms of Tuskegee and some other stuff. And what I like about what's going to happen on the 16th, and it's very diverse in terms of the participants involved, and you identified some of the entities who are involved in. And and it's going to be live streamed and all that stuff. And I think people, no matter where you live, they should take advantage of that, because I was really impressed the night I saw the one on CNN. I called up the Pastor Crawford, who was the pastor of the largest African-American church in the county. And I was telling him how elated I was about the contents of the program. And he said, he was buying into it, and he's going to be one of the participants along with you and others. So I'm really excited about this initiative, and I think people need to gather information and make their own determination as to what they want to do. And thanks again for participating.
You're welcome. I think the timing is right for this type of a thing, because we are early in the 1B phase, so we're still within a number of agencies and groups that we're trying to get vaccinated, either through the health department or through the pharmacies. This education comes at a good time, right before, whether it's a month out, 2 months out, even 3 months out, for the general population. For anyone who's still on the fence, hopefully we will be able to convince them, the benefits of the vaccine versus, risking getting COVID. And then obviously, African American and Hispanic populations are showing statistically they are more inclined to suffer, the worst consequences than the other ethnicities. So we want to make sure if there is anybody on the fence, for whatever reasons, that we try to answer those questions.
And finally, the Johnson vaccine, timetable for that, one shot?
That was announced yesterday that they are beginning to make noise so maybe within a month's time, maybe a few weeks, they could get their EAU. That could be a game changer. That might push Moderna aside, instead of getting 2 shots, here's one that's 1. But again, I don't know how much will be available once they, hit the start line in regards to what's getting ordered. But with that addition on top of the Pfizer and the Moderna, that obviously will create more vaccine availability into the communities. I just want to stress the importance and patience for everybody to understand that I could have truckloads of vaccine outside right now ready to give to people. We're just limited onto the number of people that we can actually give those shots right now until we get more funding, can hire more people and those types of things. But between the health department staff, the availability of staff that have been discussed and promised to help from ONU and KCC students, and in both hospitals being able to help when they can help, this community has done a lot of pre-planning and will be ready to go when we need to do those big events.
Mr. Hess, did you have something?
Yes, thank you, Chairman. Mr. Beavis, you might want to mention that the people in the county may get a call from outside of our area code.
Okay, thank you. I know that you and I had a discussion about that. So similar to when contact tracing started, we had to sort of promote to the public on social media and in the media that you possibly would be getting a phone call that looked like, a different area code or from outside of the area. And, coming at a time when the election was there and a lot of people are getting these robocalls and you just don't want to answer anything. The same thing is going to be happening probably with these farmed out pharmacies contacting an individual then when it's time to get their shot. So as Mr. Hess is alluding to, Meijer, for example, is having all their scheduling conducted through their corporate office, which comes from Bolingbrook. So an individual is going to get a call and it may look like it's coming from Bolingbrook. So if they don't answer their phone, it sounds like they are at least leaving messages letting you know that it's time to schedule your shot with Meijer. Please call this number and do that. So hopefully people will remember to call back. It's going to be very difficult from the standpoint, as we did before with the contact tracing, because we had one number and we could tell everyone what it's supposed to look like. But I don't know if Juul's going to be doing corporate office or local calls. I don't know if Meijer's doing corporate. Once we get some of these other pharmacies involved and other locations, or even the health department is calling to let you know it's time to get your shot, they're going to be coming from different places. But we do need to let people know. Please answer or check your messages, because that potentially could be the agency that's contacting you that you are able to get your shot now and where it is that you need to go get it.
Mr. Seroy, did you have something?
Yes, thank you, Mr. Chairman. Mr. Beavis, so if I have a bulk of school bus drivers, how should I register them? Should I have them call individually, or should I have, because I think schools are in that 1B category, aren't they?
Schools are in the 1B. We are currently doing those now. I am aware that some of the schools are including their bus drivers in
the school locally here already got their vaccines last week, and they didn't let me know they were getting them. So
I have passed your information on to Kayla, who is helping to plan this scheduling, and we will try to accommodate and get you worked in.
Okay, so I shouldn't have them call your line individually then? That was my question. Should I have my people line it up individually and
you could. You could, Mr. Seroy, but what'll happen is basically they're just getting on the list, and eventually then individually they'll be contacted, and that could take a long time. For something like that, we could talk offline to possibly find out, how many individuals are we talking about? Maybe we could arrange at one of the future locations to see if you have a group of individuals that could come into one of those clinics that we have scheduled to accommodate that.
I appreciate that. Thank you, sir.
Okay.
And just for, I guess, discussion's sake, if someone has a similar kind of business that's in a specific category, they would do the same. They could call you guys and you could arrange that. This isn't just available to county board members.
That is
Consultation. Thank you.
correct. Yes, I want to make.
I had to make sure that I said that out loud.
Thank you. I appreciate that. So yes, this is not
you, Mr.
wheeling and
Wheeler.
dealing. This is not showing favoritism to anybody. Mr. Siroy brings up a good point. Obviously, transportation is one of those essential worker positions. Those individuals are going to be coming across, individuals that are exposed or positive on a daily basis in regards to the type of work that they do. So I would, from the Kankakee Health Department standpoint, we would include bus drivers for schools in that category. If they were missed by their schools and scheduling because they just didn't think about that, and we're busy planning for how many shots and this kind of a thing for us to realize on the back end maybe who they forgot to ask. We'll try to rectify that. Now that doesn't mean we can solve it the next day. And then obviously, yes, Chairman Wheeler, we have individuals that are calling us all the time. I'm essential, I'm this, I'm that. So we have to fit them into the category or determine what exactly is their essentialness and then let them know, yes, you are, no, you're not, but get on this list at that point. So that is part of what we are trying to decipher as we go through our list. Obviously, if you register on the health department's thing, you'll be putting yourself into a category or a phase at that point. And as we run those lists, it'll trickle out and we'll figure it out.
Thank you. I just had to clarify. Is there anybody else? Nobody on the list here?
Chairman?
Oh, yes, Ms. Parker.
Thank you, Mr. Chairman. Mr. Beavis, thank you for all the things that you are doing for our county as far as the COVID vaccinations. Earlier this month, it was reported there was a new strain of COVID in Brazil, and this morning's news reported that the first case arrived to America. Do you know anything about that or how we're going to prepare for that particular strain of COVID?
I am aware. Recently, yesterday, we received a siren notice. That is one of the notices that we get from the Illinois Department of Public Health daily in regards to, the positive cases, for example. My understanding is that there are possibly up to 9 variant cases now that have been determined in Illinois. I think all 9 of them are up in the Chicago, Cook County area. So it is expected to increase. It also said within that Moderna is pretty confident right now that their vaccine would cover that variant at this point so that there's no cause. And obviously we're early in the stages now of what this variant is and what exactly that means in the scheme of, is it more contagious? Is it more lethal or things like that? They've got to study that still. But I just want to emphasize for everybody, if you don't understand that this is what viruses do normally. They mutate. As we figure them out and come up with vaccines to help stop them, they are living organisms that then say, okay, I need to change my game, and they mutate. And if we're doing a good enough job, what they do is they mutate and become weaker as opposed to mutating and becoming stronger. And that's part of what the study will do, is to determine whether or not these variants are worse or are just weakening out as we change. And eventually, like with a yearly annual flu shot, we've got it in check and we just get our flu shot, we might be getting an annual COVID-19 shot.
Okay, thank you for explaining that.
Mr. Chairman,
Yes, Mr. Lear.
2 questions, Mr. Beavis. In regard to the time between shots, have you heard anything about CDC guidance on the time between shots being extended beyond what had earlier been stated?
I have not heard any information in regards to that. All I know right now is if individuals come to us and say they want to get their second shot earlier than they're supposed to, the answer will be no. And
what about longer?
Well, the understanding is you can get them a few days longer. You can get them past your initial date. It's just that the studies were done on the, the 4 weeks. 4 weeks for Moderna. I believe it's 3 weeks for the Pfizer. So it's just that the longer you wait to do that, the percentage of the efficacy might be a little less for you. So if you get your second shot exactly on the day you're supposed to, you're at 96% efficacy for that vaccine. If you wait a week, maybe that drops to 92. I'm not sure, but the longer you go out, the less efficient it becomes.
Okay, second question. I've heard reports that one of the local pharmacies had people on the list and they came in without appointments and got shots. Have you heard any reports like that?
I am hearing some of those complaints. We are working with the pharmacies. They have agreed to comply with the rules and regulations that we're trying to tell them in regards to the phases they're supposed to be operating within. As a result of that, we give them the list of individuals they should be contacting to schedule. If there's a pharmacy out there, and we are aware of possibly one, but it's not confirmed, we are going to be working with them. But ultimately, once the vaccine leaves our hands and goes into another provider, if they cheat the system, so to speak, it's beyond my control. Other than when we become aware of it, we can make the state aware of it, similar to a complaint. Possibly, if they continue to do it, maybe we discontinue, getting their vaccine for them, and we hand it off to somebody else who will do it right.
Thank you.
Any other questions?
I'm sorry, can I ask one, Andy?
Sure, Mr. Featherling.
Okay. John, how long do you think, being that we're spread out down here, we're not on top of each other like they are in the major cities, how long do you think it takes before we get to what they call herd immunity, where we have 20% of the people vaccinated? Is there a possibility that we could actually declare herd immunity here, or say we have it?
I'm not sure. My understanding of the literature that I've seen or read has indicated that in order to achieve herd immunity, 60 to 70% of the individuals in the population would need to be vaccinated.
Okay, but what if we have 10% of the counties already had it? So does that add to the vaccine total, or does that not count?
Do you mean 10% of the population having had COVID?
Yes.
I'm not sure, because there's also discussion that possibly, this is kind of early in the stages of trying to figure out this new virus, that possibly, even though you've had it, within 90 days, they indicate you could possibly get it a second time, similar to a flu or a cold or some of these other things. So it's too early to tell whether this one vaccination that you get, or your double set, is going to be for the rest of your life, or will we find out in the next year or so that this becomes an annual COVID shot?
Right. Okay. And then if they figure out that we have, say, 20% inoculated, vaccinated or whatever, and then we rotate those 10% in there, do they come in for their vaccine shots if they've already had it, or are they saying, no, I'll wait my 90 days and come in and get it then?
Say that again.
If you call somebody that's already had COVID to give them their vaccine, are they coming in, or are you asking them to wait the 90 days to come in?
Individuals who have had COVID are eligible to receive the shot. I believe there's I'm not sure on the time frame, but there's a small time frame from when they've had it to recommending that they get the shot. So possibly we have a number who are bypassing getting their shot now if they're eligible, to allow somebody else who could get it to get it, and then they plan on getting it later. I do know that if you've had your flu shot within the past week, then you're ineligible to get your COVID shot, and you would have to wait another week before you get that then. So there are some questions that we ask when you fill out the form to help us determine, any possible side effects you may have.
Okay. And then do you have a total, or do you have a registry of people that have had it, so we know where we're at as far as the 90 days is? I mean, do we have a list of people or names, or you could say that, 9,000 added, 8,000 added, or what you could say? Are you at that point now?
We know that we're up to 12,000 approximately within our county that have tested positive. Now that's from the get-go. That's going all the way back to March, and half of those being since November.
Okay. Okay, thank you, sir.
You're welcome.
Thanks, Andy.
The only thing that I had was we're in tier 1 mitigation now. We're not back to phase 4 yet.
Okay.
Correct?
Yes.
Because we're in tier 1, there's still mitigations out there. And even phase 4 is still a mitigation phase as well. It's the only one remaining before there's a vaccine, when we can go back to somewhat operational normalcy. I remember that, I haven't read that in a while because it's been so long since I thought, when are we going to be out of this operationally? But have you done any assessments on or heard from the IDPH or Dr. Zike or anybody, when does that point come when they say, we've rolled out the vaccine, everybody's had the vaccine, now we can go back to having a county board meeting with everybody in the room? That kind of stuff. Not like you don't have to wear masks or anything, but you can get back to classrooms and everything else that we're talking about, because a vaccine was critical in that last step. That's
a great question. I think that is getting asked from time to time in the governor's press conferences. It's difficult, Chairman, because, obviously if we remember back to the beginning, he said to get back to what would be our new normal, there would need to be a vaccine available and some medications and treatments available. And both of those are true today. The vaccine is available, albeit not so much, it's in the early stages of getting everyone vaccinated, and there's definitely treatments available, and better treatment now for individuals who get sick and go into the hospital compared to a year ago. So that statement we've said in the past, where sort of the goalposts seem to get moved a little bit, that is still being bantered about, unfortunately. Obviously, if there's another surge with this variant, I hope to goodness not, but then obviously we would get stronger mitigated again and put us in a position that I just would not want to see. So I feel comfortable and I'm happy with where the county is at right now, but the governor has not said anything lately about releasing the,
whether it's tier 5 or whatever
right.
It is. Yeah. Yes, sir.
Thank you. John, when it comes to moving the goalposts, I'm sure everybody has seen on TV regarding the CTU, the Chicago Teachers Union, versus the board up there. And you heard the president say yesterday about what needs to be done in terms of testing the students, the teachers, the support staff, and also the infrastructure, new air filtration systems and stuff. So, that may have an impact as well too.
Right.
Any other questions? We spent a lot of time with you these months.
I can't wait until I can send Kelly something other than a COVID update.
Well, the board was asking if you can come to all of our committee meetings. No, I'm just kidding.
Well, that's why I plan on sending this out to everybody, so at least you can have it. We'll update it in the future as things change, obviously. So again, I appreciate all these great questions. And, again, just stressing to those you talk to or those who talk to you in regards to, just please have patience. I realistically on a given day have 4 nurses who would be able to give shots in terms of, immunizations on a given day. So, obviously COVID has impacted us the last year. It's going to continue to impact us this next year, I feel, but at least we're on the positive side, going downhill with the vaccinations, and the more we get, the less we'll have to worry about, and then hopefully we can get to that point where, we are back to our new normal, and, hopefully having meetings and everything like that, and then it's just treated as a virus like the other viruses are. And, my staff are committed to continue to do the best that they can, and we have great collaboration, with the county board and all the agencies we've been working with, already.
You know,
Excuse me.
I know I want to let you go, but there's one thing we always talk about: the frontline healthcare workers, first responders, things like that. The people that have worked in the health department for the last year have been in an absolute vice that gets cranked every day, and then it gets let up for a day, but then everything changes. The amount of pressure that they're under with the amount of staff that they have is, it's not lost. I mean, I don't mention it, so we thank everybody over there from us. I mean, there's only so much a bunt cake can do to make them feel like we appreciate them, but
I like bunt cake.
Yeah, but yeah, I'm not opposed. I've heard things, but so I just want to make sure they know that we appreciate it,
I will
because
tell them. Thank
the
you.
daily pressure in the health department has got to be overwhelming, and I know that it's tough, just like being in the hospital. So because you're never there, you're always chasing every day. And then the other thing, if anybody here would like to go back when I asked John to be at every committee meeting, like, do a rewind and look at his eyes. That's all I'll say, because there wasn't kindness I saw in his eyes. So anyway,
Deer in the headlight.
anything else? All right, everybody.
Thank you very much.
Thank you. And we don't have anything from the VAC today, or Dr. Murphy. County Administrator's Report. Nita Speckman.
Good morning. You have the staffing report in front of you. Just a couple notes about the report. Down in the state's attorney, where it looks like there was quite a bit of activity, 2 of those terminations are temporary employees related to the AmeriCorps grant, and then 1 of the full-time positions added, again, is an AmeriCorps grant personnel. So of that, the other 2 new employees there are full-time law clerks. There is one other thing I did want to note. Mr. Hunter mentioned a timing difference on something he was aware of, a new hire. The staffing report goes by the notifications we receive in payroll and HR. So in terms of new hires, you may know of new hires within a department, but until that person actually is on the payroll and we get their, so we would yesterday have received new hire paperwork for people hired within the last 2 weeks. So until we get that paperwork, we don't have a way to reflect what's going on in the department. Same for terminations. Terminations tend to lag a little bit longer because they will stay in the payroll department or payroll records until the person received, after they received their last paycheck. So they could have worked anytime in the last 2 weeks and their last paycheck won't be until Friday. So we won't remove them until next Friday. So it could conceivably be somebody that resigned the first week of January, and we won't terminate them in the system until next week. So we don't have a way of seeing that. We do try to go through the paperwork. Last night about 4 o'clock, Kelly and Joanne and I were fishing through paperwork because we couldn't quite get numbers to match up, trying to figure out who was out, who was in, why we were different, and that sometimes happens. It's not exactly perfect. It really takes a looking back a month or so to be able to make sure that we know we're right, dead on person by person, but we do go by what is in the payroll system. We try and catch what we can and get it as accurate as possible. But just so you know, you may be aware of an addition or 2 or a termination or 2 in a department that we don't know about yet. Any other questions on the staffing report? No. Okay. Really, the only other thing is retrospectively what we've been working on the last 30, 60, 90 days is open enrollment that ended December 31st. New policies are effective. Any changes are effective January 1st. So January is really a lot of time spent with why didn't I get my new vision card, which is the question of the day. We changed providers this year, so that's a bit of an issue. Some issues not quite going as smoothly as always when you change providers, so it takes a lot of manual intervention. Things of that nature. Spending a lot of time COVID related. When those surges happen, we have obviously a lot more employees out, trying to figure out which time is covered under FFCRA, the Families First Response Act, so Coronavirus Response Act. So it's determining who's got time left in that bank. When does that leave end? By the way, all that leave for government entities ended. That extra benefit granted by the federal government ended December 31st. So it's trying to figure out what to do with those employees who maybe were out in the middle of a 14-day quarantine prior to December 31st and after December 31st, and how we address those issues. So you can definitely tell the last 2 weeks that, along with the general public, it's quieted down here at the county as well in terms of number of employees that are out with COVID-related quarantines. So that's good. Moving forward, I am working with Andy on coordinating the space study, which is really kind of the next 60 to 90, 120 days. So it's getting information, trying to coordinate those interactions with department heads. So, any other questions?
Andy, I have one for Anita.
You have something, Mr. Featherly?
Yeah. Have you been contacted by White and Associates to work with them, or are you doing this on your own, having to do it on your own?
Well, I notified them after the county board meeting that the study was approved by the county board. So then last Friday, they did a Zoom call with all the department heads to kind of notify them of what their schedule is, and the fact that those impacted departments, according to the approved proposal, who would be notified, etc. I did send them a contact list, and they'll be reaching out to each department head. Right now, we're working on getting them background information related to like court cases, etc., tickets, fines, trying to determine the traffic in the courthouse. I'm working with Sandy on that. That information was given to Sandy. They had asked for any county provided population growth estimates. I received that. I forwarded that one to Dell, thinking on the transportation side. I got the information from him last Friday, and that was sent to White and Company yesterday. And then there were 3 things. Third thing was any floor plans. So that was given to Wes to try to find any of that. So at this point, it's a gathering of information to send to them. So I'm working with individual departments to coordinate and get that information to them.
Okay, thank you. We didn't mean to create a bunch of work for you, but we have to get it rolling. So Thank you.
And I did want to mention to this group, and we'll definitely mention it tomorrow in finance. A year ago, county had 542 employees. Now we're at 565. So we're going to have to at least make sure that the department heads realize that this is going to be a tough year. And if these are unbudgeted increases, we're going to have some conversations mid-year. And I'm sorry to say that, but it concerns me. It really does. In a year where we have no contingency budget, there's nothing sit off the side that is like could plug holes if things go. When you go over, you're over, and it's off. We cut it off, and I've explained that many times. So when I see hires that are at historic levels, at least in the last 6-7 years, those numbers, it concerns me. So I will just mention that. Mr. Hunter?
This though, but in terms of soft money that has been generated by some of your department heads, doesn't that address the overage in terms of the 542, the 565?
Yeah, but soft money is always tied to hard money. It's
Yeah,
never
but
100%.
you're only kicking in 20% though.
Of 20% of what we don't have.
Yeah.
That's what I'm getting at. And I see departments that are doing it that don't have grants. So there is, we can, at times that we do have the 20%, that's one thing. We're not saying don't change anything, but we can't keep going up and over and beyond that we're able to afford. And really, it's not me that's saying that, it's the budget number. So once we're over, period. And that just is what it is. It's the time we live in. If we find out that, you know, our revenues are not going to be impacted, that they're going to go back up, the current budget we have right now is at our current income levels and expense levels as we have trimmed everything back. And this is a protracted finance discussion, but when we look at what's coming in this budget year, it's at those levels. So if one of those two things changes, revenue to the good, everything's better. Revenue down, it adds exponentially to the problem. So when you go out and hire more people at the cusp of an economic crisis, it tends to impact everybody's department. So I'll just mention that.
Mr. Chairman,
Yes, sir.
to your point,
Hey, Ron.
with the rumors of the ICE program being defunded, and maybe it's time that we need to look at other revenue sources within the county to fill those gaps, so to speak, you know, that maybe this board could look outside the box of other revenue sources in the future. And I was gonna bring that up in new business, but this might be the time to just put it out there that we might need to consider other revenue sources that are available to us.
Or when revenue opportunities present themselves, take a hard look. Definitely.
Yes, sir.
Yep, I would say that is a worthwhile exercise, whether it's unofficially or officially, with I'll say subcommittees of, you know, the finance committee that would start to bring forward some ideas, some things they want us to explore, and it could be just a spitball, you know, wish list, and then we can start to go through what the county code allows us to do, and then we can go from there. So, no, I appreciate that. Any others?
Mr. Chairman, I have one.
Yes, sir, Mr. Featherling.
Yeah. Is it not correct, or is it not polite for us to educate the public here about what it costs when they go to somewhere else and buy things, or when they go somewhere else and buy a car, or when they buy their gas in Orland because it's cheaper than it is here, and things like that?
It ain't cheaper than
is there
there.
money available, to grant money or anything available to advertise things like, you know, $7 spent in your county, you know, brings back $3 in revenue, or however that worked. I can't remember what the signs used to say, but it seems like people don't know that. And when I mention it to people, they're killing, you know, Manteno by not buying gas there. They don't understand, well, why is that? And then I have to explain it to them. And people really don't know. So if they knew that if they spent money within the county, that they could prevent us from having to increase anything, you know, I think that they would probably do it, but I just don't think they know.
It's been a long source of let's say consternation for chambers of commerce, economic development people. You know, MFT would be nice to keep it here. We get a share of that anyway, but it'd be nice to keep MFT all here. But it's when you go shopping and you go, well, there is the Amazon factor where people are buying a lot. Amazon Prime next day, no air freight or anything. But it really manifests when they go up to the malls and things like that we don't necessarily have here. The type of shopping experiences people make a destination of. Cars are a little bit different. I believe those are taxed in the jurisdiction where you live, not where you buy it. I believe that's the case.
You should, oh, sorry, Andy.
No. I used to be the head of buy local, hire local. I've been down this road.
You gotta expect
and it's
that.
not 7-to-1. I commissioned a study from Olivet. It's more 2-to-1, but it's still advantageous to buy things locally. Keep that money
But
here.
if you
Yeah.
buy a car at a local dealer, the salesman gets his commission, the dealer makes a
Right.
profit, and it all stays within the county. So
I agree.
it's not just the sales tax itself, it's the actual money that's actually spent. I'm sorry, I just don't think people understand it. They don't know about it. They haven't been educated about it.
I agree. I agree.
Thank you.
Any other comments on staffing? All right, anything else? No?
No.
Okay. Short and sweet. She's trying to get out of here. I think we need to come up with some questions for Anita. Some really hard, in-depth.
Thanks for the response.
We got plenty of them. Administrative, we've got some openings, 3 openings. Mantino number 9 Drainage District, 3 on the Moments Pembroke Union Drainage District, 1 on the Raymond Drainage District, 1 on Spring Creek Drainage, 1 on Union Drainage number 2, 1 on Yellowhead and Washington Union Drainage District number 2, 8 openings on the Kankakee County Regional Planning Commission, 1 opening on the Essex Township Fire Protection District, 1 on the Kankakee Township Fire Protection District, 1 opening on the Kankakee County Housing Authority, which we will be appointing in just a moment. We at least had to put it on the agenda for the opening. Or we will be reappointing, should I say. They wanted to be reappointed. 4 openings on the GIS Committee, and there's 1 not on here, 1 opening on the Kankakee River Conservancy District. There's 1 more opening. There's 2 expired seats there, so as they figure out who's on their board now and who's resigning and who's up and all of that, we're taking applications for those positions. I encourage everybody who lives in the Conservancy District in Moments, along the Kankakee River there, you have to live in that district. We encourage people who want to apply to be part of that. Now moving on, appointments and reappointments. I've got the appointment of Tom Forberger to the Moments Yellowhead Drainage District, appointment of Keith Zellhart to the Snake Creek Drainage District, appointment of Donald H. Zach to the Kankakee River Conservancy District, reappointment of Janine Wolf to the Kankakee County ETSB, and reappointment of Doug Jones to the Kankakee County Housing Authority. Is there a motion to combine and approve?
Yes.
Mr. Hunter, anybody on Zoom? Ms. Polk with a second. Roll call vote, please.
Mr. Lear,
Aye.
Mr. Hess,
Aye.
Ms. Polk,
Aye.
Ms. Weber,
Aye.
Mr. Payton, Mr. Payton, Ms. Parker,
Aye.
Ms. Parker,
Aye.
Mr. Kinzinger, Mr. Fairfield,
Aye.
Mr. Carrico,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Long,
Aye.
Mr. Hunter,
Aye.
Mr. Wheeler,
Aye.
Mr. Searoy,
Aye.
motion carries.
Alrighty, any new business? Somebody say something?
Sam said something, but no.
Sam.
Talking to somebody else, okay. And no new business? Any old business? I have a piece of other business. The photos, the pictures are here, the group photo. So we're gonna put those in your mailbox. Those that are here can run upstairs and grab it if you would like. So we've got all those together. A little bit different. It's not a group photo. It's kind of like your 6th grade picture where everybody's stacked next to each other with headshots. So, as my mom used to say, you can go ahead and put that on the fridge and scare the mice away. So, so is there any other motions by any chance from anybody, Mr. Hess?
Mr. Chairman,
Yeah.
I would move that we close the meeting.
Hello?
Miss Polk had something first, Bones. Hold on just a second. Go ahead, Miss Polk.
Okay, I'm gonna make this short and sweet and to the point. I just wanted to say again, thank you everybody for the Dr. Martin Luther King celebration. We were able to double the scholarship money, 1. Number 2, next year, we're in the planning already. It will be held on the campus at Olivet Nazarene University.
Well, that'll be nice.
That's all.
Yep.
Okay,
Thank you for that.
thank you. Mhm.
Mr. Hess, I'm sorry, did you have something?
I move to close the meeting.
There is a motion to
Second.
adjourn, a second. Miss Polk jumping in. Is there anybody who would like to keep going? All right, all those in favor say aye.
Aye.
Those opposed, same sign.